Hello, this is Chapter 3, Cultural Consideration, exam relevant topics most directly supported by the Chapter 3. So the cultural concepts appear throughout, especially under management of care, psychosocial integrity, safety, and infection control, and health promotion. For the NCLEX, usually on those categories might appear. I will offer again an overview on chapter 3 and a few question practice, about 7 with rationale. So we go now. So let's review for the NCLEX. Follow the subcategories. It's management of care, psychosocial integrity, safety and infection control, health promotion and maintenance, psychological and psychosocial adaptation. So likely testable topic from chapter 3, like under management of care, you see they have 3. So use the interpreters and informed consent. We know that because why? Choose the best interpreter, certified medical, not family. Verify patient understanding via teach back, document language, services used. Now you need to avoid the classic pitfall to avoid is like picking bilingual staff without certification or nursing or using a child as interpreter. Another one can be legal mandates and class standards. So the nurses identify responsibility to provide equal access, recognize the Title VI language requirements, the legal status, assuming the patient must pay for interpreter services. Then the delegation and cultural competence, when decide which tasks must stay with the RN when cultural assessment or the patient teaching is involved, and to avoid delegating initial cultural assessment to the caregiver or the LVN. The second subcategory for the NCLEX is the psychosocial integrity, implicit versus explicit bias, ageism, racism, xenophobia. We learned this in the keywords. So you need to identify the statements, actions that illustrate bias. Select nursing intervention that reduce its impact and avoid failing to link use nurse behavior, like for instance, less pain med offered to proper outcomes. Another one is the spiritual and cultural rituals and plan care around prayers times, fasting, end of life rites. So avoid scheduling conflict tests without negotiation. So you kind of know their routine and you kind of need to have a clear communication when it's better which task goes first. Inclusive, affirming communication with LGBTQIA. Choose respectful pronouns. We talked about in keywords. Room segments, screening recommendation, like for instance, pap smear for transgender men with cervix. Then avoid misgendering or assigning semi-private room with unsupportive roommate. On the subcategory of safety and infection control, the transcultural pain assessment. Ask like select appropriate pain scale or nonverbal cues for diverse patients. Avoid judging pain level solely by facial expression. Then the subcategory of health promotion and maintenance is like health literacy and patient education. Adapt materials to reading level. Demonstrate teach back, offer pictograms. Avoid overloading patient with written jargons. Then the subcategory psychological and psychosocial adaptation, it's likely from social determinants of health, SDOH, we talked on outlines, discharge planning, ask recognized transportation, food, housing barrier, involve social work, community resources. Avoid labeling patient not compliant without exploring structural obstacles. Next, we have the case sets, cultural assessment models, the Leninger, Sunrise, Ginger and David Hizar. Then we have Campingha Bangkok, ASKED process, expect, drag and drop, or matrix items matching assessment findings to model domains. The clinical judgment sequence, they have 4. Recognize the cues, which is family spoken person, answer for the patient, cultural clue. Analyze cues and hypothesize. Decide if this affects consent validity. C. Take action. Involve certified interpreter. Clarify decision maker role. Lastly, it's evaluate outcome. Patient correctly restates procedure risk. For sure will be always to evaluate outcome, no matter in every case and in nurse life is to evaluate the outcomes. The health disparity data interpretation, select the most at-risk group for a listed disease based on epidemiologic table. Choose priority community level intervention. For 4, ethical dilemmas around bias. It's a lot of dilemmas. I remember it was in LV and NCLEX I got the ethical dilemmas. Here it's in unfolding scenario, nurses implicit bias leading to delegate triage, identify where policy risk management steps in and which therapeutic communication repair trust. Very important. 3, nursing decision model guides. So we have 3 culture care preservation, support beneficial traditions, herbal teas that don't interact with meds. Then we have culture care accommodation, negotiate timing. right? Like for dialysis and prayer. Then we have 3, cultural care repatterning, which is like help patient modify harmful practice, like for instance, replace high salt pickled food in patient with hypertension. Go over the Leninger sunrise models, which shows technological, religions, philosophical, kinship and social, cultural values, life ways, political and legal, economic and educational. So here on you need to ask the patient or family, do you use home monitors, apps, or herbal devices? And why it matters for care is like avoid interactions, like magnet on pacemaker and merge fork tool safely. Then for the religion, we have any faith practices we should honor while you're here. So it's like you need to schedule meds around fasting or plan space for prayer. Another one, it's like who helps make health decision, right? So you need to identify spoken person discharge support, right? Then the next one, what foods or routines help you feel well? That is like tolerate the diet orders, ideal timing. We have do immigration or insurance issues worry you? Correct to case management early. Any concerns about paying for meds or transport? Activate financial aid, 340B, pharmacy links. Then we have how do you best learn from picture, videos, or talking. Chosen teach back style to avoid the jargon. So this is kind of, and it's much more questions there. It's very nice to kind of relook through the chapter. Now we go to a question. Practice questions, chapter 3, and we have the first question. It's a multiple choice. It's management of care, right? A Spanish-speaking patient is preparing to sign surgical consent. Which action by the nurse best meets federal language access standards and support management of care? A. Ask the patient's adult daughter to act as interpreter. Schedule a certified medical interpreter by video before consent is obtained. Use the hospital's bilingual housekeeper because she is immediately available. Rely on printed Spanish education materials and assess understanding with gestures. So what can be? Okay. Yes. Schedule a certified medical interpreter. Question 1 of the rationale. So why B is correct? The Title 6 of the Civil Rights Act and class standards require qualified language services for informed consent. Video interpretation is acceptable, meets accuracy standards, and documents compliance. A, why it's wrong? Family members may have limited health vocabulary, right? Omit sensitive content and introduce bias. C. Bilingual staff outside interpreter roles are not trained to convey medical nuance or confidentiality, right? Confidentiality. D. Written materials alone are insufficient. Consent demands real-time, two-way communication. So that's why B, it's correct. Question 2. It's our lovely SATA. The nurse demonstrates cultural humility when performing with action. So the key word of the cultural humility, we have to think it's a lifelong, respectful process of self-reflection that recognizes power imbalance and seek to learn from patient. So meaning ask, what does good health look like to you before planning, right? So now let's think about the question. Use a standard pain scale and assumes it is valid for every patient. B. Ask, what does good health look like to you before care planning. C. Shares a short story about personal holiday traditions when invites the patient to share theirs. D. Refers all cultural questions to the hospital chaplain because they are the experts. E. Reflects after shift on how implicit bias may have affected care decision. So what can be? It's SATA, so it's more than one. Right? Ask, what does good health look like to you? Shares a short story about personal holiday traditions because it's cultural humility, and reflects after shift on how implicit bias might have affected care decisions. So the rationales why BCE are incorrect: humility, self-reflection, curiosity, recognition of power imbalances, and partnership with the patient. Oh wait, I said incorrect. No, they are correct. A, it's incorrect. Assuming one tool fits all ignores cultural variation in pain expression, opposite of humility. D, delegating cultural assessment dictates RN accountability. Humility is participatory, not avoidance. Practice question number 3, multiple choice. Which nurse's statement reflects implicit bias? Again, the keyword, implicit bias requiring self-reflection. A. I will request halal meal so you have foods that follow your faith. B. Let's schedule family teaching when your grandmother can attend. C. All the patients never understand new technology. I will skip the patient portal explanation. D. I am unfamiliar with that herbal remedy. Can you tell me how you use it? Implicit bias. All the patient never understand new technology. I will skip the patient portal explanation. So the implicit bias is like unconscious attitudes or stereotypes that affect understanding, actions, and decision. So it's like meaning the using standardized pain scale reduce implicit bias in analgesic dosing. So that here is the rationales. The hidden stereotype of the adults lack tech skills guides the nurse's action, demonstrating implicit ageism. The rest is like show cultural responsive patient-centered behaviors. The question 4. Here is critical judgment. 4 patients will be discharged today. Using social determinants of health SDOH knowledge, which patient needs priority referral to the social worker before leaving? In NCLEX, I doubt to say this to be obvious, to kind of understand, but probably say today 4 patients will be discharged or 4 patients will be discharged, or which of the following patients is the priority for discharge, something like that. It's always discharge now or today. And patient needs priority referral for social worker before leaving. A 45-year-old with hypertension, speaks English, lives 5 miles from clinic. B 70-year-old with health failure, lives alone, must ride 2 buses to reach pharmacy. Right? 2 buses. 30-year-old with ulcerative colitis has private insurance, downloads electronic instructions. 52-year-old following cholecystectomy, family drives her to follow-up appointments. 70-year-old with heart failure lives alone, must ride 2 buses to reach the pharmacy, right? It's like, wow, lives alone and 2 buses to reach the pharmacy. So the B is like transportation barrier plus chronic condition plus social isolation. Hidden readmission risk rate highlights that early intervention supports equity. A, C, and D, the rest have like fewer immediate access challenge. So standard discharge teaching usually suffice. Practice question 5, again our favorite, select all of the apply, to reducing health disparities. Okay. Question. Which nurse-led initiatives align with evidence-based strategies to reduce health disparities? Select all of the apply. A. Developed unit dashboard tracking pressure injury rates by race ethnicity. B. provide discharge instruction only in English to encourage assimilation. Only. Train staff to use tech bag with patients scoring less than 12th grade on literacy screen. Schedule elective procedures exclusively on weekdays for staffing A's. So the correct answer are developed unit dashboard tracking pressure injury rates by race. Then C, train staff, collaborate with community health workers for home visits. So ACE are correct because equity dashboards reveal gaps, literacy, tailored education. B violates the resources-driven scheduling neglects patients, right? Six, I'm gonna go fast. A nurse cares for Cambodian patient who burned small herbal incense, folk practice at home for pain relief. The hospital is scent-free due to asthma protocol. Using the sunrise model, which action is best? They're not going to put here sunrise model, but probably this scenario. I mean, different, not copy and paste, but similar. But here I would like to kind of go back and look for the sunrise model and which action is best, right? Allow incense burning in the room, but open windows. Explain the policy and provide an electric candle with recorded chanting. Remove incense and say that isn't allowed here. D, ask the family to stop the ritual permanently. No, you can't do that. So explain the policy and provide an electric candle. It's kind of accommodate between and between, kind of negotiate, right? So here is the rationale of B. Is like the cultural meaning, aroma plus ritual, but accommodates safety with no smoke. 7 question. Question number 7. Which findings suggest the nurse performed a complex sunrise-based assessment? SATA. Documents patients prefer learning method. It's short videos, schedules, meds without asking, without fasting days. Notes that 2 adult children share financial responsibility. Writes language barrier, use eldest child as interpreter. Orders dietitian counsel for high salt cultural foods. So the correct answer are document patient preferred or learning method. Notes that 2 adults children share financial responsibility. Order dietitian counsel for high salt. So why it's correct? It's ACE cover educational, kinship, economic, and dietary lives ways race. B ignore the religion. D uses unqualified interpreter. So that That's it. Thank you for watching, and I hope this was very helpful. Thank you.